What's up, everybody? My name is Eric. Welcome to my channel, Eric the Tutor. What's up, everybody? My name is Eric. Welcome to my channel, Eric the Tutor. Today, we're going to be going through cranial nerve anatomy, and we're going to be going through practice problems, getting you guys ready for your second midterm coming up. And we're just going to jump right into it with the practice problem. So, this is kind of how they can test you. So it's kind of like secondary, tertiary information where they give you a clinical case, they give you different symptoms, and you have to correspond, find the nerve, but then you have to see, oh, okay, I know which nerve we're talking about. I need to be able to recognize it from this view and say which foramen it's going to be exiting the cranial vault, right? So let's just kind of work through these. I want you guys to try them out. Try to work through this as quickly as you can. If you find yourself having trouble, then you're going to want to pause the video and go and review that cranial nerve that you might be struggling with. All right, but this is to kind of practice, and we'll go through each problem right now, okay? Let's look at the choose the labeled foramen that transmits the cranial nerve involved in the clinical correlate described in parts A through D. Each letter may be used once, not at all, or may be used many times. All right, so a patient has considerable weakness of the tongue muscles, except palatal glossus muscle. So again, we need to be really quick, and we need to be able to recognize which nerve innervates the tongue muscles. What do you guys think? Yeah, so it's going to be cranial nerve 12. Cranial nerve 12. So that's the hypoglossal nerve. Hypoglossal nerve is going to innervate all of the tongue muscles, so they're, all the different tongue muscles, except for palatal glossus. Palatal glossus is going to be which cranial nerve? Palatal glossus is going to be cranial nerve 10. Cranial nerve 10. So we're going to talk about that in lab on Thursday when we go through oral cavity, but you see it now. So tongue muscles, we're thinking cranial nerve 12. So now we need to figure out, where does cranial nerve 12 exit the cranial vault? Yeah, it's going to be the hypoglossal canal. So which of these letters is the hypoglossal canal? Well, we can kind of go through each of them. So letter A here, for example, letter A is pointing to this structure here. So what's this structure right here? Yeah, so this is part of my ethmoid bone, and specifically this little line here, this is my crista galli. Crista galli, right? And you can kind of see all these little holes here, kind of next to it, right? That's going to be my cribriform plate of the ethmoid bone, which transmits the olfactory nerves. So it can't be letter A. Letter B, which foramen is letter B? Yeah, letter B is the foramen rotundum. So I can write that. This is for foramen rotundum. And then what about letter C? Yeah, that looks like my foramen ovale. What about letter D? Foramen spinosum. And then what about letter E? Yep, that's going to be my foramen lacerum. Foramen lacerum. Okay, so let's just keep moving. So I know that the hypoglossal nerve doesn't go through any of those holes, right? So it can't be any of those. Letter F looks like it's pointing to which structure? Yeah, that's actually my hypoglossal canal. So answer choice for letter A here has to be F, right? So it's got to be that hypoglossal canal, because we figured out the cranial nerve 12 innervates the tongue muscles. Let's move on to question number B here. So B is the posterior 1/3 of the tongue is numb. All right, so let's talk a little bit about posterior versus anterior 1/3 of the tongue. All right, so I have a nice little table here, and this is kind of showing me some innervation to the tongue. So we have some taste, and we have some general sensation going to the tongue. And we have different parts of the tongue, right? So we're going to have more of an anterior 2/3 of the tongue, and we're going to have a posterior 1/3 of the tongue. So we have an anterior 2/3 of the tongue and a posterior 1/3 of the tongue. We have taste and general sensation. So there's going to be different nerves going to these different boxes. All right, so we have going to the anterior 2/3 taste. We have the chorda tympani. And I know my chorda tympani is a branch off of my facial nerve. So cranial nerve 7. For general sensation going to the anterior 2/3 of the tongue, we have my lingual nerve. And I know my lingual nerve is a branch off the trigeminal, the 5-3 division of the trigeminal nerve. Alright, so that's more of like that mandibular division. And then if we go to the taste and general sensation to the posterior 1/3 of the tongue, that's going to be the glossopharyngeal nerve for both. Alright, so glossopharyngeal nerve for both. So now we know the difference between anterior 2/3 of the tongue and the posterior 1/3 of the tongue and the different nerves supplying those regions. So we can kind of answer the question now. So here is the posterior 1/3 of the tongue. The answer has to be glossopharyngeal nerve, so that's cranial nerve 9. So where does cranial nerve 9 exit the cranial vault? Yeah, it's going to be through that jugular foramen. So I don't think we've hit the jugular foramen quite yet. So let's go through more answer choices. So letter H here is my jugular foramen. So my answer choice for B is H, jugular foramen. Let's move on to part C. The patient presents with trouble finding their balance. So immediately, what are we thinking of? If we're thinking of balance, yeah, it's going to be that vestibulocochlear nerve. Which is cranial nerve 8. Cranial nerve 8. All right, so where does the vestibulocochlear nerve exit the cranial vault? What do you guys think? Yeah, it's going to be the internal acoustic meatus. So which letter is that? Well, we haven't quite hit it yet, so here is my internal acoustic meatus. Internal acoustic meatus. So answer choice for C is G. Let's move on to D. Patient can't smell the scent of the coffee, so we know we're thinking of the olfactory nerve, which is cranial nerve 1. So cranial nerve 1 is the olfactory nerve, and it kind of exits that cranial vault through the cribriform plate of the ethmoid bone. So it's kind of those little dots there up over at A. So part D is going to be answer choice A. All right, so this kind of gives you a taste of like how they can ask you different types of cranial nerve questions. I got a lot more planned, so stick around and stay tuned for more videos. But that's all, guys. Thanks for tuning in. We'll see you next time.